Assalamu alaikum students. Uh, Today's topic is how to appear in the Viva. And to appear in the Viva is a tricky thing. First of all, when you appear in the Viva, uh, your dress should be to mark. Always wear the proper dress. Don't wear the jeans and the t-shirts and very fancy dress. Keep it very simple and when you enter in the room, you should be very uh, smiling face and confident face. Say Assalamu alaikum, then sit in the chair. Don't play with either pencil or pen or anything and just start the Viva. If you not understand any questions, don't waste your time. Simply says, Sir, I don't know this topic. Right now, I don't remember this. So please ask me the next question. So the examiner will ask you the next question. So always the examiner not have any fixed pattern of asking the question. Most of them. Sometime when there is a structured viva, all the questions are written. But most of the time, only topics are written and the examiner will ask you the questions with your answer. So don't say anything. Don't say anything by which you don't know the detail of this thing. Don't say any words, don't say any disease. अ, कोई ऐसा जुमला कोई ऐसी चीज़ मुंह से ना बोले जिसके बारे में आप जानते ना हो ठीक तो अगर आप ना जानते हो और आपके मुंह से निकल गया तो एग्जामिनर ने वो पूछ लिया तो बैड इंप्रेशन होगा हमेशा जो फाइबर स्टार्ट होता है वो आसान सवालों से होता है starting from the definitions, simple definitions, then maybe the classifications, and when the examiner judge number one, your depth of the knowledge, number two, your concept, and number three, how will you know about the applied of this subject, applied physiology. For example, if I am asking the why about this cell, then I simply ask the structure of the cell membrane, function of the cell membrane. Then I ask you function of the glycocalyx. Then further detail, I ask you about the movement across the cell membrane. And if you answer me all these questions, then I go into the depth of the subject and ask you the applied physiology of the cells like the apoptosis, cell death, and the cancer. And if you not give me the answer about the cell membrane, definitely I'm asking about you the apoptosis or the cell death or the cancer. But if you give me the answer of about the structure of the cell membrane and the functions of the cell membrane, then I judge that this student have a basic knowledge. And then only if I want to give you the more number, I want to give you the distinction, then only I ask you about the cancer and the apoptosis and the cell death, hypertrophy and the atrophy, all these questions. Similarly, in the chapter of the blood, the Viva will start simply. What are the functions of the WBC? What are the function of the RBC? What are the function of the hemoglobin? What is the normal values of the RBCs, WBC, hemoglobin, platelets, all these things. Then if you give the answer of that, simple questions, definitions, then the examiner then asks you the detailed question like what is hemostasis, what are the steps of the hemostasis, what is the intrinsic and extrinsic factor, something about the blood grouping. Then if you answer to these questions, then examiner want to give you the distinction. He or she will ask you about the hemophilia, anemias, detail of the anemias, and for example, in nerve and muscle chapter, the Viva will start from the simple questions. Structure of the muscles, skeletal muscle, difference between the skeletal muscle and the smooth muscle, the properties of the skeletal muscles, the contractile protein of the skeletal muscles. Then, if you give the answer, then examiner will ask you about the excitation, contraction, coupling mechanism of the muscle contraction, the difference of between the smooth muscle and the skeletal muscle contraction. Then, after that, if you give the answer of that, then the examiner will ask you about the action potential, steps of the action potential, resting membrane potential. Then he or she will ask you about the rigor mortis, tetanus. Then go into the applied physiology. Like in the cardiovascular system, simply ask about you the definition of the cardiac cycle, definition of the cardiac output, definition of the blood pressure, then events of the cardiac cycle, then further detail hearts about the heart sound. First heart sound appear in which period of the cardiac cycle, then about the second heart sound, then and in detail about the ECG, the abnormalities of the ECG, the arrhythmias, shock, all these things. So always the YY start from the basics. And if you give the answer to the basic questions and the examiner then judge that you know the subject, then he will pass you. And if you want to get some distinction, then definitely you have to know about some applied physiology as well. So inshallah, in next lecture, I will give you the further detail of rest of this chapter, inshallah. Thank you.